name is Dr. Hayman Rambaran. I'm the medical director at Straight and Narrow, covering most of the facilities, methadone clinic, detox, and residential programs. We have a task and a duty to perform, and there will always be problems. But how well we are able to get past the problems, how we are able to work within the constraints that we are posed with to achieve the end result. And I think the goal is to try to help to cure, to get people moving from the addictive phase into normalcy. So that is where the focus is. My dad was my role model. He was not highly academic guy, but anything that he had to do, he put everything into it. And it was not looking for secondary gains. It was trying to achieve the end result. In addiction, I treat patients who are very sick. They come in withdrawal, and I feel good at the end to turn them around and see them walk out and go into different levels of treatment, aftercare, and whatever. And I see them all the time. I don't look at them as any less of a person. They just fell victim to drugs, and they had no control over it. And I think as professionals, if we decide to do something like that, we have to have some level of passion, to achieve that. I don't look at it as a task. I get fulfillment. I get contentment. And this I try to share with patients, who I see, and they, have a good, type of rapport. I make them feel comfortable, because I think, they come into me, besides giving the medication, there's a little more to it. I want to instill something. If they could leave with a couple good, thoughts that they can, reflect on, I see that as something positive in treatment. It's not only the medication. This is where the art of medicine, has to be tied in with the science.
Hello, everyone. My name is Nikolovski, and I'm the Executive Director of Straight and Narrow. I'd like to share a little bit about Straight and Narrow and the important work that we do. Straight and Narrow began in 1954 as a treatment program for male alcoholics, and since we have expanded to a comprehensive social service agency that services 1,200 people on any given day. We have a continuum of care of programs that service residential, adult inpatient programs, residential women and children programs, a halfway house component, and outpatient programs for adults as well. We have a medication-assisted treatment program, which we service both our outpatient and residential populations. I'd like to take some time today to acknowledge our Caritas nominees. Our operations department, Straight and Narrow Operations Department, under the leadership of Mike Rettagliata, and Dr. Hayman Rambaran, our medical director of Straight and Narrow. During the COVID pandemic that turned all of our lives upside down, they were a key element, along with our other senior management members, in terms of continuing operations at Straight and Narrow, keeping us all safe, providing the highest of medical standards, health and safety standards, and implementing much needed, oftentimes in the moment, new protocols to ensure that our clients receive the best care. I'd like to emphasize the importance of our mission, how much Straight and Narrow gives back to the community, services the people in our care. We have a slew of community-based programs, from daycare centers to a family success center, which provides preventative services to our local community and families. And we are thankful for every dollar that is donated this evening in helping us continue our mission. So thank you for everyone. We are excited to be here tonight, and I am very proud to acknowledge our Caritas nominees this year. Thank you.
I'm Michael Rettagliata. I'm the Director of Operations for Straight and Narrow Catholic Charities. Straight and Narrow is a long-term and short-term drug rehabilitation center. Well, I think the biggest concern right now is the opioid epidemic is really out of hand. People are using drugs that they don't even know they're using, such as fentanyl, who think it's heroin, and things like that. I see people having a harder time now. People not working, people are required to stay home, social distance, and people seem to be using more substances, especially alcohol. I'm very fortunate to have the leadership team I work with and my staff that works directly with me. They're all very dedicated, they're all very smart, Everybody plays a key role in the entire process, and we're a family. I love my job. I love the people I work with, and I love the people that we help. If we don't do it, who's going to do it? I have a purpose to go to work every day, and I truly enjoy it.